One.
Hello, everyone, and thank you for joining us here today. I'm Kathy Roth-Duquet, and CEO and co-founder of Blue Star Families. I'm here today with my friend and colleague, Kobe Langley. Kobe?
Hey, Kathy, good to see you. Thanks for having me.
Kobe and I, Red Cross and Blue Star Families, decided to get together and launch this campaign early in January when Blue Star Families, a national nonprofit serving military families, heard from our members concerns about the COVID-19 vaccine. So we reached out to the Red Cross, our partner in the Team Up for COVID-19 campaign, to see if we couldn't help put together some information that could give military families the kind of insights they need. Kobe, we had such great insight from our last town hall. How did it go from your perspective?
No, I agree with you. I mean, we totally did. First of all, American Red Cross is super proud to join Blue Star Families and you as a partner in this important and timely campaign. You know, it's inspiring to see the work that you've been able to do over the course of COVID-19 with Blue Star Families and so many of our other nonprofit partners. We've all heard great feedback from our partners, and we have plenty of folks that are out there giving back and caring. You know, we've got folks on VA hospitals and military installations all around the world. And our last session was viewed and commented on pretty much nonstop. So just like you know, super excited to be here. We saw a thirst for information. You know, a lot of our military family members still have a lot of questions. They want more information about not just COVID-19 and the vaccines, but also just information on where to go and how to get information. So Kathy, it's great joining forces with Blue Star Families here again today. And all of our veterans, military family members, caregivers, and their families, everybody that's watching out there, we hope that you get the answers that you're seeking today. We brought in a great lineup of experts to answer any questions that you all might have. So if you're watching out there, as the conversation progresses, please engage with us. Engage with us in the chat to the right of the screen. Make sure you ask your questions, share your thoughts. Members of the team are going to engage with you and get your questions answered. So we want to know what you're thinking. Kathy, again, thanks for having me and the American Red Cross. Really looking forward to this discussion.
Thank you, Kobe. And now it's my great honor to welcome Dr. Anthony Fauci. Dr. Fauci needs very little introduction, but Dr. Fauci, I do want to share with you that after our last town hall, we found that 63% of the respondents who had been opposed or undecided before they listened to us reported that the event increased their likelihood of receiving the vaccine. So that's a great result. And I wanted to share that with you. And that's why we asked you to come back. And we're so pleased and delighted that you agreed to join us.
Well, thank you, Kathy. It's a real pleasure to join you and the Blue Star Families, as well as Kobe and the American Red Cross, for this very, very important discussion about vaccines. So thank you for having me.
We're really eager to hear any updates and information you have to share with us today. I'll let you lay some out, and then I have a bunch of questions that have been piling up that I'll get to afterwards. Thanks.
Okay, Kathy. So rather than give a real long presentation, I'm just going to take a couple of minutes to just update you on where we are right now. And then I know there are a number of questions, particularly related to vaccines and other aspects of this particular outbreak and the endeavor. So first of all, where are we right now? I mean, obviously the numbers are very sobering. We now have gone over the 500,000 deaths and 28 million infections. We had a very serious surge that began as we entered the cold weather of the winter and the holiday season, which peaked at a very high level. There was a point there where we were at about 300 to 400,000 new infections per day and between 3,000 and 4,000 deaths per day. And the hospitals were being stressed and strained with the number of beds that were occupied, up to 140,000 or more. What has happened over the subsequent weeks to about a month is we had a peak at that very high level, and then we started to come down in a very sharp deflection downward, which is really very good news. However, over the last week or so, we've had a stabilization or a plateauing of coming down, which is really quite troublesome because every time we've had another surge, it starts off with a plateau. That's all the sobering news. The encouraging news is that as the days and weeks go by, we're distributing more and more vaccines to individuals. Right now, we have over 80,000 vaccines that have been injected. We have now a considerable number of people in the tens of millions who've had 2 doses and many more that have had a single dose. So what we need to do right now is with the challenge of the variants, namely mutational versions of the virus around, we need to do 2 things. We need to make sure we continue our public health measures of the things that we speak about all the time, the masking, the physical distancing, the avoiding congregate settings, particularly indoor, but also the light at the end of the tunnel, as I mentioned a moment ago, is the fact that we have vaccines. And when vaccines become available to you, please take the vaccine. It is the best and most important intervention that we have together with the public health measures. So we still have challenges, but things look good as we progress, particularly in the arena of vaccines. I'd be happy to answer questions now, Kathy. Let me stop there because I know there are a number of what I think are really good questions.
Thank you. Yes. And, with all this vaccine rollout, we're really proud that the U.S. military is playing a big role in that. We have tens of thousands of National Guard and even active duty troops who are playing a role. A number of my friends are deployed for those missions right now. We're hearing from some of our members that folks are feeling we're a young and a healthy force. In addition to the COVID-19, we have tens of thousands, if not hundreds of thousands of military members also on missions that don't allow social distancing. So with the COVID work, the regular missions, how important is it that these young, healthy military members actually get the vaccine?
Oh, it's extremely important for so many reasons. Obviously, we want to have force protection, as we all know, and there are many ways for force protection. And certainly when you're having a situation where even though the overwhelming majority of these individuals are young, healthy men and women, some have underlying conditions, and some can, in fact, have an outcome that could be severe. So it's for personal health, but it's also to preserve the integrity of the force, because when you have outbreaks of infections, like we see sometimes on various craft ships that we've had, outbreaks that have measured in several hundreds to 1,000 of individuals, we want to make sure that in the future, looking forward, that does not happen anymore. And with the vaccines that we have, that some of which are high, all of which are quite effective, anywhere, from 72 to 94 to 95% effective in preventing clinical disease. It is absolutely critical that we get the military vaccinated and vaccinated as expeditiously as possible.
And they could pass it on to other people too, right?
Oh, of course, of course.
Yeah, so that to protect.
Well, the numbers are interesting because we know now that the endpoint or the vaccine efficacy primary endpoint for the vaccine trials are prevention of clinically recognizable disease. However, what we don't know yet, which we will get this information in the next few months, is that it is entirely conceivable that a vaccinated person could be protected against symptomatic disease, but still could be infected and potentially pass the virus on to someone else. What we're doing studies now is to determine 2 things: the level of virus in the nasopharynx of people who are vaccinated but who have breakthrough infections, and whether or not they transmit it or not to other people. The latter will be very important information that we will find out from a number of studies.
Well, that's super helpful. So I have a couple more military life questions. We're coming up to PCS season. This is the permanent change of station time. About 400,000 people connected to DoD typically move every summer. Another 200,000 people transition out of the military. It's a lot of people moving. So looking at that, what kind of precautions should people be taking as they prepare for these moves this year?
Well, I mean, we just mentioned one of them, the idea of getting vaccinated. For those who are not vaccinated, the situation should be practicing the public health measures that we talk about literally every single day, multiple times a day. And that is the uniform wearing of masks, the avoiding congregate settings, particularly indoors, and to using physical separation. Now, in the military, there are times so obvious to everyone, particularly when you're in a closed quarters with people, it's very difficult to maintain physical distancing, which is really the reason why vaccination becomes so important to the military. In the same way as vaccination against many of the diseases from, going back to various conflicts that we've been in, where you want to vaccinate people when they go geographically to a setting that has a high incidence of a disease that might not be prevalent in your own home base, but when you go to a different place. With regard to COVID-19, unfortunately for the world, it's prevalent virtually everywhere because it's a global pandemic.
So we know right now about 30% of our service members who could get the vaccine are not opting to get it. We know we've got a role as family members, and I wonder we have a lot of family members on this call right now. What would you say to them about what their role might be in encouraging vaccination?
Yeah, I think the family members could be very important in encouraging vaccination, because when you get vaccinated, it is not only to protect yourself, your own health. I mean, obviously, a young, strong, healthy man or woman in the military understandably would have the feeling, well, the chances of my getting seriously ill are very, very small. That is true statistically, but we have examples of people otherwise very healthy, athletic, who either get seriously ill, and some have even died, but also would get a moderate degree of symptomatology that lasts for a considerable period of time. We call that the post-acute sequela of COVID-19 syndrome, which we're actively studying. But beyond that, for your own personal health, you want to protect your family and particularly potentially vulnerable members of your families, the elderly, mothers and fathers, grandfathers and grandmothers, people who might be having underlying conditions that put them at risk for severe disease. By preventing yourself from getting infected, you're part of the solution to this outbreak, because by getting infected, even though you may not know it, you may be inadvertently transmitting the infection to someone else, even though you have no symptoms. In reality, like it or not, you're propagating this outbreak. So instead of being part of the solution, you are innocently and inadvertently being part of the problem by not getting vaccinated. So that's the reason why we say you've got to think of your own health, which is really very important, but you got to think about your societal obligation to society, including people close to you personally, as well as other members of families of other individuals.
Yeah, we sign on to serve and protect, right? So I guess the protecting part has to be foremost. I have a question here asking for a little more clarity about the Johnson & Johnson vaccine and how it's different from the previously approved vaccines.
Yes, the Pfizer and the Moderna vaccines are what's called messenger RNA vaccines, where messenger RNA is the genetic code that tells the body to make certain proteins. So when you inject it into an individual, it codes for the spike protein on the virus. And the body sees that, thinks it's the virus, but it's not. It's just a protein of the virus. It makes a good immune response. And then when you get exposed to the actual virus, you're protected. That's the mRNA of Pfizer and Moderna. It's a little bit different with the J&J. The ultimate end game is you still make an immune response to the spike protein. But instead of injecting just the mRNA, you get a benign, harmless cold virus called adenovirus, and you stick in that the gene, the DNA of the spike protein, which then codes for RNA, which then codes for the protein. So at the end of the day, both of them are inducing a response to the spike protein of the COVID-19 virus, which we call SARS-CoV-2. So they're called different vaccine platforms. Both are very effective, highly effective, particularly against severe disease requiring hospitalization and sometimes leading to death.
So your explanation of the mRNA, I think, was one of the most popular things about our last town hall. People felt like they were with, the Bill Nye, the science guy, and getting smarter all the time. So thank you for that. Should one try to hold off for one vaccine or another, or just get the first one you can get?
Oh, I would recommend get the first one you could get. If you go into a clinic and one vaccine is available now and another one will be available in a month, I would go right for the one that's available now. Given the circulation of viruses in the community, you want to get protected as quickly and as expeditiously as you possibly can.
And what about these new strains? Is it better to wait longer and maybe the vaccines will be more effective against the new strains, or will even new strains be protected?
No, not at all, as a matter of fact, because the best way to get protected against the new strains is to get vaccinated and get a high enough titer to the strain that's contained in the vaccine, even though it isn't matched directly to the strain that's in the community. What it is that a high enough titer will give you enough cushion to get some degree of protection against the variant. So I would not wait. Waiting would be a mistake.
And a lot of our families are asking us about long-term side effects and if they should be concerned. Do we know enough about those?
Well, in the history of vaccinology, the so-called long-term side effects, apart from the immediate sore arm or maybe a little bit of an ache that you get within, 18 to 24 to 36 hours, that's called reactogenicity of the vaccine, to be different from adverse events that you get, where you get a serious problem sometime after the injection. When the FDA does their safety concern profile, and when they determine the safety and efficacy, what they do is that they make a calculation that if you look at all of the history of all vaccines, the overwhelming majority, practically all of them, occur within 45 days, between maybe 15 and 45 days, no later than that, from the time a person gets their last dose, which is the reason why when the FDA does an emergency use authorization, they don't grant that until 50% of the people who have been vaccinated are already 60 days beyond their last dose and have not gotten any adverse events. Then they know that that vaccine is really safe, because the likelihood of a late long-term problem is vanishingly small based on extensive experience over decades and decades with any of a number of vaccines.
That's very helpful. We have questions about folks who want to finally go visit their grandparents. Now that more and more grandparents are getting vaccinated, is it okay to visit the grandparents even if the family itself hasn't been vaccinated?
Well, you know, the CDC literally in the next couple of days are going to come out with guidelines for what you do when you're vaccinated and interacting with another vaccinated person versus when you are vaccinated and interacting with an unvaccinated person. If you're talking about grandparents, grandparents generally, not always, but generally are elderly. And we know that elderly are at a high risk of severe disease. Once you get into that category, you've got to be very careful. But as I mentioned, rather than get ahead of the CDC, I think you can wait a very short period of time. We should be hearing some guidelines by the CDC of how people who are vaccinating could interact with vaccinated people as well as with unvaccinated people.
So we're getting a little sneak peek of something that might be coming. That's good. We like those.
Right. But one thing I can tell you that almost certainly will be in those guidelines, and maybe more, again, I don't want to get ahead of them, is that when you have two vaccinated people, either family members or friends or what have you, and both of them are vaccinated, in the setting of the home, a reception, a little cocktail reception, a dinner, in the home, with family, with friends, all of whom are vaccinated, then you don't have to be following the guidelines of masking or physical distancing, as long as you're all vaccinated and you're in the setting of the home. That we agree upon. There will be more than that, more discussion of that when the guidelines come out, but rather than discuss that, let's wait for the guidelines to come out.
That sounds very good. And what about if there's children in that setting? The adults are vaccinated, but we know the children aren't yet.
Right. You're trying to sneak a question in on me, and I'm telling you that we're going to wait until the guidelines come out.
Okay. Well, let's talk about children. Right now, sometimes up to 18, maybe up to 16. Where are we with the thoughts about kids?
Well, when you're talking about vaccines, there are studies that are ongoing now that are looking at children in some of the vaccine candidates, not candidates, but EUA already authorized, that from 12 years old on, that by the time we get to the fall of this year, maybe not on the very first day of school, but certainly in the context of the fall term, it is likely that we will have enough information to be able to vaccinate high school level children. When you're talking about elementary level children, that we are doing studies that are called age de-escalation. We do safety and immunogenicity studies on children from 12 to 9, then 9 to 6, 6 to 2, and then 2 months to 2 years. And we will get that data likely by the end of this calendar year, and children in elementary school will likely be able to be vaccinated in the first quarter of 2022.
Okay, good. I have a question here. My husband is National Guard doing COVID vaccine duty. how do I protect myself when he comes home, even though he's been vaccinated? Am I protected because he's vaccinated, or do I need to take more steps?
Well, in your own home, when you have a vaccinated and unvaccinated person, I said that will be the guidelines that will be coming out literally in a couple of days. And again, I know you're asking questions that are important, but I had promised that on the record I would not be ahead of the CDC. You will get that answer really quickly, okay?
Okay, we'll keep them out on duty for a few more days. And then pregnant women. We have a lot of concern about pregnancy. A lot of my own staff are pregnant, and everyone's, of course, extremely concerned about protecting their unborn children. Is there a risk of taking this vaccine while pregnant?
You know, the actual studies, this is an answer I can give you in completion. The actual studies of the safety and efficacy of pregnant women have not been done preemptively on vaccine women to ask that question. However, there is some mitigating circumstances that lend to some confidence, or at least giving us some reason to have pregnant women vaccinated. If you look at the post-EUA vaccinations, there have been several thousands of women who have elected, even though being pregnant was an exclusion criteria for the clinical trials for the vaccines. Nonetheless, when the EUA was granted for Moderna and for Pfizer, several thousands of women elected to get vaccinated. Many of them were in healthcare settings, physicians, nurses, respiratory therapists, or what have you, because we know that there are deleterious effects on the pregnant woman and on the fetus if you get infected and get COVID-19 while you're pregnant. We weren't sure of that earlier. The data look pretty strong now that it is pretty dangerous to be infected when you are pregnant, because you can have an increase in adverse outcomes of the pregnancy and the health of the mother. So many women have elected to say, even though we haven't specifically looked at the safety in the mRNA trials, we're going to get vaccinated anyway, because the risk to us or health of ourselves and our fetus is much greater if you get the infection than if you get the vaccine. And as it turns out, despite thousands of women getting vaccinated, there have been no obvious red flags about problems, which makes women have more confidence in getting vaccinated. The J&J vaccine prior to COVID-19 has been used against Ebola, not the COVID vaccine, but the platform that is used. In other words, the same type of a vaccine was used against Ebola in Africa. And in fact, many pregnant women and lactating women were in those trials, and there was no real issue that we saw at all with those trials.
Great. Okay. I get one last question, and here it is. Are there more vaccines coming out beyond the 3 that we have right now? And can you tell us about them?
Yeah. Well, there are 2 trials that have already fully enrolled, and we'll probably be getting data about them sometime in April. And that is the trial of the AstraZeneca, which is the chimp adeno platform. We also have a trial that's fully enrolled with Novavax, which is a soluble recombinant protein together with an adjuvant. And then down the pike a bit, still in a phase 2 study, there's the Sanofi company, which is also a soluble protein with an adjuvant.
Well, that's exciting to look forward to. Dr. Fauci, it seems our time is up. I cannot thank you enough for being with us here today. I know you're tremendously busy, and it means the world to this military-connected community that you shared some of your precious time with us today. I did emphasize our active duty guard and reserve components, but we have many thousands of military veteran families with us today too, and we're going to be focusing on their questions coming up. We're so grateful that you returned to speak with us. Thank you for your leadership, and thank you for joining us.
Thank you, Kathy. Thank you for having me. It's been a great pleasure. Right. Bye-bye.
Bye-bye. Before we hear from our senior leaders at the Defense Health Agency and at the Veterans Health Administration, I'm really honored and excited to welcome our newly appointed Secretary of Defense, Secretary Lloyd Austin. Secretary Austin has a long history serving in uniform and supporting the military community together with his wife. He knows firsthand the joys and sacrifices of this military life from his many years in the U.S. Army. It's now my honor and my privilege to welcome Secretary Austin to say a few words to us all today. Secretary Austin.
Hello, I'm Lloyd Austin, Secretary of Defense, and I'm very happy to join you today, even if it is virtually. And I want to thank the Blue Star families and the American Red Cross for hosting this event and for everything that you do on behalf of military and veteran families all across the country. The men and women of the Defense Department can stand up and defend this country because, in no small measure, you stand up for them. And so again, on their behalf, let me say thanks. Let me also thank you for trying to help raise awareness about the coronavirus and the safety and the efficacy of the COVID-19 vaccines. You know, there's a lot of information out there and a lot of fear and a lot of anxiety. We've never been through something like this before, at least for the last 100 years. And it's frightening. And it's hard to know how to respond. And sometimes it's even hard to know who to believe. But we owe it to our teammates and to their loved ones to make sure that they know the facts, and to make sure that they all have the information available to them before we try to make the vaccine available to them. And so that's why events like this are so important. And it's why it's so important that we try to see the problem through others' eyes. You know, last week I had the chance to visit with some of our troops in California as they vaccinated people in Los Angeles and at a Navy base in San Diego. And I have to tell you, I've been with a lot of proud troops before, but I really can't remember when I've seen anyone more proud and more purposeful than those vaccinators were as they helped their neighbors and their friends and their fellow citizens. One soldier called it a bestowal of trust. Another one described the satisfaction, in fact, the relief that it gave him to administer the vaccine to his mother. And as he described that to me, it nearly brought me to tears. There's a lot of science behind these vaccines. In fact, it's downright remarkable what these laboratories have been able to produce in such a short period of time. It's unprecedented. And the safety record is out there for everyone to see. You can go online at the CDC website and at defense.gov to learn more about just how safe and effective these vaccines really are. But we need to remember that this is a personal decision and that real people have to make that decision. And so I also encourage you to talk to your doctor just like I did, and talk to your family and to those who count on you. And think about how your decision will impact on them. And for those of you in positions of influence and leadership, please share what you know with the people around you. In my experience, people armed with the best information, with facts, will make the right decision. And we need every voice in this fight to help to get word out that the vaccines really are safe. And while getting vaccinated will certainly help protect the people around you, I'd ask that you also continue to take the important and necessary precautions to slow the spread of the virus. And this includes maintaining social distance and washing your hands and properly wearing your mask. We need your continued support because the health and safety of our workforce and their families is paramount to our nation's security. Again, thank you for giving me this opportunity, and thank you for all that you do to help us get the word out. And thank you for taking seriously the trust our military family has bestowed on all of us.
Thank you so much, Secretary Austin. There's so many of us that are personally inspired by your leadership. As an OIF veteran myself, 82nd Airborne Division guy, we've learned so much from you over the years. Thank you for sharing that important message with us today. We're extraordinarily grateful for your leadership in this issue, for your peerless commitment to sharing the science and facts about this important issue. Thank you to Mrs. Charlene Austin for both your persistent and unwavering caring for the health and wellness of the total force. So now I'd like to welcome back Lieutenant General Ronald Place. General Place is the director of the Defense Health Agency. He's joining us again here today. He's led a distinguished career in the U.S. Army and currently leads a joint integrated combat support agency enabling the Army, Navy, and Air Force medical services to provide both a medically ready force and a ready medical force to combatant commands in both peace and war. Lieutenant General Place, welcome back. Can you share a few words of advice for us?
Yeah, thanks, Kobe. Thanks for having me back. Thanks to you, the American Red Cross. Thanks to Kathy and the Blue Star families. Original words of advice, I'll tell you, is that things are going well by truly any way we measure it. Let me give you probably a half a dozen to start with. At least within the Department of Defense, we're using our supply as fast as we get it in. 85% of what we received has already been given to one of our beneficiaries. Second, the number of sites, we've gone from 16 sites in late December to 335 sites in the United States, overseas, deployed, shipboard, massive increase. Third, we've currently administered almost 1.3 million doses. Great work by the entire team. Fourth, very, and I mean very low rates of adverse effects, similar to what we're seeing in a normal year from influenza. Fifth, the supply chain is working. The only thing that's keeping us from success is severe weather. And I think all of us remember that from a couple of weeks ago. And finally, sixth, our immunization teams have truly been taking this seriously. They are very careful with every dose that we have. And we have a loss rate of 0.04%. Everything that we get is going into our beneficiaries. Now, that's almost all good news, but I get it. You heard from Dr. Fauci, you heard from the Secretary, vaccine hesitancy is real. And I get it. And while we're in a period of limited supply, it's probably okay if some of us want to observe and think it over. But speaking as a physician, the safety and effectiveness of the approved vaccines is exceptional. And every passing week, the evidence only grows stronger. Again, you heard Dr. Fauci just talking about that. Our service members and families are paying attention to the news, to the CDC, to the FDA, to Dr. Fauci, and their local healthcare experts. I'm certain that we'll continue to see increased confidence with every passing week.
General Place, thanks so much for that update. So we've got a lot of questions. They're streaming in. So I want to get to a couple of them. Probably the most important one is when does DoD anticipate having the vaccine widely available to military family members and the broader military connected community?
Sure, that's a great question. So we're looking at in a tiered responsibility, similar to what we've seen from the CDC. We have those tiers, and that goes for service members, family members, retirees, et cetera. And as a reminder, all of our beneficiaries can be vaccinated inside our system or in the civilian healthcare system. But going back to that tiered approach, we have 1 Alpha, which is largely the healthcare practitioners, first responders, police, firefighters, et cetera. 1 Bravo and 1 Charlie, those are over 75-year-olds, critical national defense. 1 Bravo, 1 Charlie, over the age of 65, but not 75, under the age of 65 with significant medical problems, those sorts of things. 1 Bravo, 1 Charlie, that's where we are in most of our locations. Tier 2, the general population without significant medical conditions, that's the largest population. As I mentioned, most of our locations are in 1 Bravo, 1 Charlie. So therefore, we are currently focused on critical national security and the medically at-risk population. Now, for each individual person at each individual location is probably going to vary a little bit. In fact, some of our locations are in tier 2 right now. Not very many, but some of them are. I see a significant number of our locations moving into that tier 2. The general population are young, healthy, everyone sometime in April. So still working through those issues right now, but in the relatively near future, open to everyone. Finally, when your community begins distributing the vaccine to your population group, you can receive it free of charge anywhere that provides immunizations. Again, inside of our system or out in the network, out in the community, in pharmacies, community mass vaccination locations, civilian hospitals, civilian clinics, civilian private practices, anywhere. Just make sure that you bring back the information so that we can put it in your electronic health record and then help you manage that over time.
That EHR is so important, the electronic health record, and thanks for sharing that information. I'm sure everybody is exceedingly happy to know about the potential opportunities coming down the road. We're really interested, another question's coming in about, has DoD determined the priorities for families who are PCSing soon or those who are deploying it, in transit?
Sure, that's a great question. There's 2 parts to the answer. The first is for service members deploying. We provide the vaccine with enough time for all of our service members to receive both doses before they deploy. It's happening now. It's working well. We haven't had a single unit or a single organization where that's been a challenge. For families, it's important to know that we're shipping the vaccine everywhere in the United States and overseas. So when your tier comes up, no matter where you are in the United States, OCONUS, coming from OCONUS to the United States, when your tier comes up, you get the vaccine. And in our system, while in many locations, it's just one version of the vaccine now, as supply becomes more and more and more, all of our locations will have, at least for now, what we have the majority of, Pfizer and Moderna. And as the Johnson & Johnson Janssen vaccine becomes more available, locations will have that as well. So people don't need to worry about it. No matter where they are, we'll get them the vaccine.
I got it. And that really does answer the question about supply chain for service members. That was another question that we had. And it sounds like everything's on schedule. That's super reassuring. So I want to talk now about vaccine hesitancy. So, there's hesitancy among the military population. There's a recent study, in particular with communities like mine, people of color, with such a large portion of the military represented from ethnically and racially diverse communities. It's a big question. I'm really interested in knowing, what is the Department of Defense doing to help ease this anxiety and to encourage vaccination in communities of color?
Sure. I mentioned in my opening comments, and I'll give you just a bit more details to it here. We're monitoring the uptake amongst everyone, our service members, our family members, retiree family members, as well as our civilians and employees. We're across all of it. I was in Hawaii last week and saw our operations and opportunity to speak to some of our service members of all backgrounds, all demographics. Some service members said they wanted to wait because they thought others were at greater risk than themselves. In terms of the declination rates, whether it's people of color or not, it's not just what I have to say, but it's really what those who are around everyone has to say. So family members, friends, their first sergeant, their squad leaders, their roommates in the barracks, people that they interact with on post. In general, people are getting their information from their local sources. So here's my answer to that. The safety record of the approved vaccines are exceptional. As Dr. Fauci mentioned just a few minutes ago, over 80 million doses have already been administered in this country with very low numbers of adverse events. Anaphylactic shock, some other side effects, but very low numbers of actual events and even fewer hospitalizations and no known deaths from the vaccine. So I just said it, 80 million doses administered and no deaths. What if there was 80 million cases of COVID and no vaccinations? Well, right now we're seeing a case fatality rate in the United States of 1.8 from COVID, meaning of those 80 million doses would be 1.440000 deaths. That's right, almost 1.5 million deaths. That's just the math behind the science. So I get hesitancy. You heard him talk about the long-term effects of that sort of thing. But the fact of the matter is the infection itself, COVID itself, is horrifically more dangerous than vaccination. And it's irrespective of all demographics. And that's my answer to everyone, people of color or anyone else.
That's exceedingly convincing argument, and I haven't heard it quite articulated that way. But you know, it is about safety at the end of the day, and there haven't been any reported deaths from all the vaccinations. And so you're right. It's about influencers too, making sure that family members. You know, I talk to my family and try to communicate to them how safe the vaccine is as well. But that does matter as well. Another question that came across is a third of our military family members are moving every year. And one of the challenges with moving is not really necessarily knowing what kinds of precautions they should take as they prepare for the moves in the coming months. Do you have some advice for those family members?
Sure. I like going after Dr. Fauci because a lot of what I can say, I'm repeating what he said, and I think that's a pretty good place to be. I think we're on a good path to defeating the virus, and it's going to take a number of actions, whether we're PCSing or not PCSing. But the most important thing is to protect yourself. So just like on the aircraft, they tell you, you know, if we depressurize, put your own mask on first, and then help your kids. First thing, protect yourself. Get vaccinated. And then second, encourage your family, your friends, everybody else to get vaccinated, because as we move across the country, that's going to be key to it. And if we want things to get back to normal, if we want to be able to, as we PCS, to check in with our grandparents, when we want to see friends along the way, it will be much better if we're vaccinated. You got the teaser from him as well. Pretty soon we're going to have more information about what that means. So that's the first thing. Second, while we're waiting our turn as we prepare to PCS, do all the things that your mom told you to do when you were a kid, right? Stay home when you're sick. Wash your hands. Wear your appropriate face coverings. Physical distancing where it's appropriate. All those things. I mean, we've been at this for a year now, but the end is in sight, and that's why we need to keep our guard up. So make good preparations, know who you're going to see along the way, keep yourself safe along the way, and get vaccinated when you can.
That's great advice. So many people want to make sure they're adhering to the safety protocols to keep their family members safe, and that's really good advice coming from somebody that has so much background experience like yourself. Last question. And this is an important one. A lot of our military and veteran caregivers and spouses have indicated that their service member eligible dependent is currently not considering the vaccine. Caregiving by itself is challenging and stressful, and it's just one more worry. Can you provide maybe a couple of words of advice or information that a caregiver can share to encourage their dependent that they're taking care of to receive the vaccine?
Sure, Kobe, thanks. That's a great question. I think the first thing we need to do is approach everyone with respect. So the first thing we need to do is listen. And I mean, listen to understand, not listen to respond. Some people may have an underlying condition that makes them wary of the unintended consequences that may come from a vaccine. That's normal, that's rational. And some are familiar with past injustices in our health system and withhold trust from that health system. I get that too. Some have heard of adverse effects after taking the vaccine and they want to avoid them. I get that, but we need to listen, and then we can help guide people. And a few things that seem to make a difference include these. First, no doubt in my mind that there's risks of COVID, both initial and long term. But those risks of COVID far outweigh any risks that come with the vaccine, caregiver or the receiver. Sometimes I hear that individuals are fearful of unknown long-term effects. Again, you heard Dr. Fauci talking about that. I understand it, but again, just as much weight needs to be given to the long-term effects of the disease. Further, infectious diseases by definition involve all of us. And my taking the vaccine doesn't just help me, it helps the family members, it helps who I'm caring for, it helps who I live with, It helps everyone that I work alongside at my office. It helps everyone that I go to the store around, even people I don't know at the commissary, grocery store, airport, wherever. Third, we're working through evidence from clinical trials to see what makes a difference here, what makes a difference in our communities in America, what makes a difference overseas. Now, we vaccinated the elderly in nursing homes first, and now we're watching hospitalization, deaths, new cases plummet along those population. In Israel, in fact, deaths, hospitalization cases are all dropping as they now have vaccinated over 50% of their population with 2 doses. So my advice to anybody who has caregivers, my advice to anyone who's concerned about vaccination, my advice to anyone really, it's all the same. The sooner we all get vaccinated, the sooner the pandemic ends.
Absolutely. I love that. It encapsulates it so clearly. But it is important to listen because, folks are concerned. And I wrote this down. You said, listen with understanding. I think it's so important just to listen to folks and let them express their issues and concerns. But you're right. The bottom line is we all need to get vaccinated to get out of this mess. So thank you, Lieutenant General, please.
I was just going to say, and not judge people, truly listen. And you're right about that. Thanks, Kobe.
That's right. So thank you. Thank you, General Place. I know our military-connected families and caregivers have been listening intently. Deeply appreciate your willingness to share your insights. Thank you for all you've done through the pandemic to support our military-connected community. We look forward to working with you in the coming months as we work to end this pandemic and get back to normal. Thank you. Thank you so much.
You're welcome. Thanks for having me.
So now I would like to welcome Dr. Cameron Matthews to answer a few questions. Dr. Matthews is the Assistant Undersecretary for Health for Clinical Services at the Veterans Health Administration within the Department of Veterans Affairs. In the community, we just call it the VA. Her career at the VA within the VHA has focused on community care, underserved populations, and advocacy. Dr. Matthews, thank you so much for being with us today.
My pleasure. Thank you for allowing me to join the conversation. I feel like I'm following some very major conversations, so this is great.
So if you could share with us just some general thoughts, about COVID and what the VA is doing, and then I've got a couple questions for you.
Great. Yeah, VA, we're very proud of how we've been able to respond to the pandemic and also how we've been able to generally serve veterans in many different times of need throughout the last year. This has been a difficult year for so many of us. We've been unable to connect physically or even just feel that connection through the virtual space. But I think what we've tried to do and what I believe we've succeeded in is really allowing for those areas of connection. Expanding our virtual care over the last year has been phenomenal. We've increased more than 1,000% the number of appointments that we've provided. And now we turn to this vaccine. We've been in it now for some weeks, and we're quite proud of the numbers that we've been able to reach, both of veterans and our employees. That's somewhat, I think, a piece that we've needed to prioritize, not as much as, of course, the veterans, but in order to keep veterans safe, we need to make sure that our frontline workers in the VA are safe and are protected as well. So we've now vaccinated, as of the end of February, more than 2 million veterans. This is wonderful. This is all due in part to the unbelievable leadership and really fortitude of our employees at our local facilities. And we'll continue to reach out. We're reaching out by text, by email. There's still a great need for supply in order to reach all veterans, but we will definitely be coordinating as quickly as we can for every community.
Thanks, Dr. Matthews. Clearly 2 million vaccinated, 1,000% increase in appointments. The VA is doing amazing work for our veteran community and our caregiver community. We're definitely a lot of questions about eligibility. So if you wouldn't mind, could you share with us where is the VA in the process and who is currently eligible to receive the vaccine?
I'm glad everyone's asking that question because I think this is a general area of confusion, and I hope I can help shed a little bit of light on this. We are following the CDC's guidelines. In fact, we were involved in helping create those and helping understand risk stratification. Some of our facilities are currently vaccinating into the class 1B. We call it CDC's 1B. Some facilities have actually gotten down that risk stratification model into the 1C category. 1C, of course, is veterans ages down to 65 or those who have other high risk conditions, and then any other essential workers that aren't in class 1B. The issue, and I know the area of confusion, is that some facilities are in 1B, some in 1C. That's because of the different needs of each facility, the different number of veterans that qualified even in class 1A versus 1B, the number of veterans above age 75 in class 1B, definitely higher numbers in certain parts of the country than others. So those parts of the countries that have been able to really make that outreach and get those appointments scheduled for veterans, or even allow walk-in appointments for those who already fall into 1B, they've finished their supply, they've reached those veterans, they've vaccinated even the employees in that class, they have gone ahead and opened up appointments to 1C. So our apologies definitely to confusion. I know a lot of veterans and families communicate across the country, and it seems as if it's an inconsistency, but really it taps into what our supply is at every facility. We're trying to distribute it equitably, of course, but then also take into account what are those facilities that have more veterans that need and high risk of higher age. Of course, those higher risk categories, of course, lead to higher hospitalization rates and unfortunately higher rates of death. So we are trying to take the best population level approach while also assure equity. So thanks for that question. It's definitely confusing, but with each facility, again, we're continuing that outreach as quickly as possible.
So you answered actually the next question. So I just got popped up on my screen. They were asking about the process and whether it's different, and so clearly it is. It's different by location because you all are following the CDC protocols and guidance, as you mentioned, and so it does tend to be slightly different in terms of eligibility depending upon where you are in the country. So I'm assuming that that's going to be kind of veterans experience going forward, that it's going to vary by location, depending upon where you are.
And unfortunately, it even may vary based on other parts of the state where they're located. So our VA facility, of course, gets its own supply, is taking care of its own important population, which is, of course, its veterans, its caregivers, and its staff. That's very different from what's going on in the rest of the state. So yes, definitely an area of confusion. We're hearing a lot of feedback. Is there any way that we could provide more consistency? But I think the concept, of course, is to make sure that we're optimizing our supply as much as possible, making sure that we're reaching those veterans and caregivers that need it the most. And that may differ from the way the state that facility, that veteran is located in.
Yeah, I got it. It makes perfect sense. So a lot of our caregivers are asking about access to the vaccine for caregivers. So Red Cross partner organizations, we serve this community pretty much every day. Blue Star Families, TAPS, Wounded Warrior Project, Elizabeth Dole Foundation. We work really hard to support these caregivers and engage thousands of them every day. And they're asking the question, once they heard Secretary McDonough mention a campaign to vaccinate caregivers, could you tell us a little bit more about this effort and how caregivers can access the vaccine?
This is so important. I mean, we're isolated, right? But we are with our caregivers and a lot of times, and their safety is just as critical as is taking care of the veteran themselves. We're excited to be implementing exactly what Secretary McDonough described, which is the ability for vaccination and testing for both primary and secondary designated family caregivers within the program of comprehensive assistance. This, of course, can be coordinated at the same risk level that the veteran actually falls. So those classes 1A, 1B, 1C that I described, that is when the caregivers become eligible. The appointments can be coordinated along with the veterans. And the veteran themselves does not need to necessarily accept the vaccine in order for the caregiver. If we're still having that conversation within the family, that's not necessarily a reason why the caregiver couldn't move forward with scheduling their appointment for the vaccine. So we're happy to provide this assistance as well. And of course, that's taken into account the number of caregivers that we're able to cover in our supplies and again, in our ability to schedule those appointments.
That makes perfect sense as well. And it's also good to know that the veteran themselves doesn't necessarily have to take the vaccine if there's still questions about it, but the caregiver, so long as the veteran is within that eligible category, can take access to vaccine. Similar and related question, homebound veterans and caregivers. Can people receive the vaccine from the VA within their own home?
Definitely. Our outreach is inclusive of our homebound programs. We're even reaching out to some other congregate facilities, other nursing homes. Of course, our state veteran homes, we're assisting where that's needed. This is just as critical. We are not asking veterans to especially those who are homebound, to step out of their safety zone, essentially, and possibly expose themselves while exiting the home. But of course, there's other safety concerns as well, too. So our teams, our facilities, in performing that outreach, are also planning trips to reach as many homebound veterans as they can in, of course, the order of risk stratification again.
I got it. So I have a bit of a selfish question. So I come from a large African-American family, lots of veterans, my dad, aunts, uncles, cousins. We all want to know, should we go to va.gov COVID-19 to register? And other veteran families like mine, there's plenty of them. Other veterans may be eligible for the COVID-19 vaccine. What should we do to access the COVID-19 vaccine using VA benefits?
So it's very easy. We actually have this amazing tool called the Keep Me Informed tool that will give you as much information as you need on va.gov. We really recommend that you just easily search through the information that you need to read about the data about the vaccine, about how to coordinate your appointment with your facility, and to share information about the science, about the data. I come from an African-American family as well, too. Trust me, I'm having those conversations with my loved ones. I'm trying to convince a good number of them. But the number one convincing point by far, both for my family and friends, as well as other doctors that I've talked to about this, is to share that I myself have gotten vaccinated. I myself have promoted that my parents get vaccinated, and they have done that. I think sharing of information, all of the information and data that's been shared on the town hall today is helpful. I think we need to answer everyone's questions, and that's exactly what va.gov is able to do. That's exactly what your VA provider is able to do. It's about seeking out that information, understanding, of course, that there's concern and there's potentially lack of trust in what that vaccine might represent. But again, the science and the data are there. Dr. Fauci, of course, we all really appreciate the information he's able to provide us almost on a daily basis. But the data is accurate, and this vaccine is safe.
Thank you, Dr. Matthews. I got it. So it's Keep Me Informed, va.gov/COVID-19. Get everybody signed up. Thanks for being with us. We know you're super busy supporting the veteran community during the pandemic. The Red Cross is committed to calling over 100,000 of our clients and tell them about this important resource for all of our veterans and their caregivers. We appreciate you taking the time to answer our questions today. Thank you so much.
Oh, thank you so much, Kobe. Great conversation.
So with that fantastic dialogue with medical experts from both the VA and DoD, it's now my honor to welcome Secretary Dennis McDonough, our newly appointed Secretary of Veterans Affairs. Secretary McDonough has a long and storied career supporting the military-connected communities and our veterans. He's cherished by those that know him as a true servant leader and someone who can bring a whole-of-government approach to our community challenges and opportunities. He cares about veterans, and he'll fight for us. We're honored to have him here with us today. Thank you, Secretary McDonough.
Good afternoon, everyone. Kathy and Kobe, thanks for bringing together Blue Star families and American Red Cross to host this important event. You know, it's the honor of my lifetime to lead VA in serving veterans, their families, caregivers, and supporters. We live in peace and security today because of the sacrifices of generations of veterans. Caring for them and their families is a mission that should unite us all. And one of the most important ways we can care for our veterans during this pandemic is to encourage all of them to get the COVID-19 vaccine. Our ultimate goal is to vaccinate all eligible veterans, veteran caregivers, and VA healthcare personnel who want to be vaccinated. All veterans enrolled for VA care are eligible for vaccination when their local VA facility has sufficient supply of the vaccine. And veterans who are not enrolled for VA care are encouraged to enroll if they're eligible. And we encourage veterans to use the Keep Me Informed tool to sign up for updates about VA vaccination in their area. We want veterans to receive the vaccination because that's the best way to care for themselves, their families, their loved ones, and their colleagues. Now, I know there are some who have reservations about getting the vaccine, but I'm here to reassure you the COVID-19 vaccine is both safe and effective. Every year, the American Legion gives a prestigious award to the very best doctor and healthcare professional at VA. Last week, they gave that award to all of VA's healthcare professionals as a collective group. American Legion made that decision for a few reasons. They did it for the around-the-clock work those professionals are doing to battle the pandemic. They did it because during the pandemic, those professionals have been giving the very best care to veterans and, in some cases, Americans who are not veterans. In short, American Legion did it because VA care providers are excellent. Well, here's what those world-class medical professionals shared with me about the safety and effectiveness of the vaccines. Here are the facts. First, you cannot get COVID-19 from the vaccines. The vaccines do not contain the coronavirus. Second, all the contents of the vaccines are well known and they're safe. Third, the benefits of the vaccine in preventing serious illness or death from COVID-19 are greater than any potential risk. Fourth, both the Pfizer-BioNTech and Moderna vaccines that VA provides were tested in diverse groups of people, including African American, Hispanic, Asian, and Native American populations, and about half of them were older adults. Fifth, to date, VA has vaccinated over 1.5 million veterans, VA employees, veterans caregivers, and employees of other federal agencies. Over 1.5 million and no significant safety concerns were ever identified in these or any other groups. And listen to this. The Pfizer-BioNTech and Moderna vaccines reduce the risk of getting COVID-19 by about 95%. And on February 27th, the FDA approved an emergency authorization for the Johnson & Johnson single-dose vaccine. This vaccine does not need to be refrigerated, has proven 72% effective in preventing moderate to severe COVID in the US, and offers complete protection against COVID-related hospitalization and death 28 days after it's administered. Listen, I know we all want to safely get back to doing the things that are most important to us. And widespread vaccination is the best way to safely do that. So get your vaccine as soon as you can. VA is providing vaccination at 251 facilities across the country. We're going to add more sites as the vaccine supply increases. And we're offering COVID-19 testing and vaccinations to primary and secondary caregivers of veterans in the Program of Comprehensive Assistance for Family Caregivers. Because one of the most important things we can do is to help caregivers take care of themselves while they're taking care of their veterans. I'm committed to making sure every veteran who wants to be vaccinated has that opportunity. Ending the spread of COVID-19 across this country is a call to service. And I hope every veteran and family member will join us to help bring this pandemic to an end by getting vaccinated. President Biden gave me a clear mission to be a fierce, staunch advocate for veterans and their families. Protecting them during this pandemic is a critical part of that. So let's work together. Let's make sure veterans and all Americans have the care and resources they need. May God bless our veterans and this great nation. Thank you.
Kathy, please unmute.
Oh, I think I muted, so I'm not sure how much we heard you, but I would like to, okay. Did we hear me talk about Secretary McDonough? I wanted to thank him. Let me repeat that just in case we didn't. I was commenting on how Secretary McDonough was so gracious and responded to our request to be on this town hall immediately after being confirmed in the VA. And the fact that so many of our senior leaders have been so responsive to our invitations is really gratifying. And now we asked some friends from the private sector outside of the military and veteran health system to join us to talk about vaccine distribution, since many of us will be outside of the system and getting that help. So I am now welcoming Mr. Dave McIntyre, President and CEO of Tri-West Health Alliance, and Dr. Kevin Vigilante, Executive Vice President and Chief Medical Officer at Booz Allen Hamilton. Dave and Kevin, great to see you both again.
Thank you. It's a pleasure to be here.
Wonderful. Thank you for agreeing to answer a few questions. So I'd like to start, Kevin, with you, if I may. So from your perspective, what do we need to see in terms of vaccine distribution to create a greater sense of trust? And what's Booz Allen Hamilton itself doing to facilitate the creation of trust in vaccine distribution?
Yeah, well, certainly the kind of event we're having today is an important contribution to that, because it really is around communication. It's so important to address misunderstandings, misconceptions, and so forth. And here at Booz Allen, it's the same. And so we take great care to communicate with our employees, a third of which, by the way, are former military or military spouses. So the well-being of military and former military is very important to us. And so we really focus on, providing these forums to discuss with employees the safety of the vaccine. And so as a physician, I've taken a lead role in that. And one of the things, I'd like to share, because it comes up with our employees quite a bit, is this question around, was this rushed through, these vaccines? And the prior speakers have talked just about everything else. They've really done a great job. But one thing I just would like to address is that. And I think that, because there is this misconception that these were rushed through. And really, we were able to get these through more quickly because the manufacturing of them started at the same time that the clinical trials started. But people should understand that these clinical trials to test the safety of vaccines were done with 30 to 40,000 people to begin with. And there are 3 levels of security there. The first level, it's a data safety monitoring board that looks at every single person getting the vaccine during the clinical trial where it's first tested. And that data safety monitoring board is completely independent, can stop that trial and say, this is not safe, or they can let it go on. So that's the first level. Once that's completed, it's submitted to the FDA. The FDA examines every shred of evidence that was produced, the data from that trial, and they decide, is this safe to approve? But there's also the advisory board on immunization practices, which is completely independent outside the FDA. And that board also looks at the data and then advises the FDA to see if they agree. And that is an independent board. And when that deliberation is done by that outside board. It is public now. Those deliberations are done, they're streamed, people can see the conversations, it's all very transparent. So when these were approved, they got unprecedented scrutiny on the safety issue. And of course, that was back in December, January. And now since then, of course, we've done 80 million doses. And there haven't been serious adverse events. A few allergic reactions, but those have been about 2 to 3 per million and treated quickly without any harm to the individual. So a remarkable safety record. And I think communicating that with honesty, frankness, forthrightness is really, because people want to know, if you explain to them how this really proceeded, then they develop more confidence in the process. Let me pause there for a moment.
I think it's a great point, and I'm glad you brought that up. We talked about it at the last town hall, but my neighbor worked at Operation Warp Speed, and I remember her telling me this is building on years, if not decades, of prior work. So thanks for bringing that up. And then let me ask you, Dr. Vigilante, from your perspective, so what's the role of the private sector here in fighting the pandemic?
Yeah, well, I mean, what we really need is public-private partnerships. I think it's sort of the government has unprecedented now capability to roll out to produce this vaccine. But as we can see, it's been difficult sometimes the last mile, actually getting shots in people's arms. And there's a tremendous amount of, private sector capability that needs to be leveraged. Even when you think about the difficulties with, scheduling and registration and all these things that, actually commercial organizations do quite well, and sort of, emulating that and harnessing that. We have really tried to focus on identifying best practices. And we create, and we send out a few times a week, the best practices that are happening across the government, because that's very important, because usually when this is done, there is some sort of technical assistance to the states that disseminates best practices. So they know what's working, what's not working to actually get shots in arms. That, that groundwork was not laid. And so now we have to go back and do that. And so we're trying to help disseminate that kind of information.
I think I love that phrase, getting the shot into the arm. And that's what this is really all about. Once people decide to do it, then the next hurdle is how. So Dave, let me turn to you. What needs to be done to create greater access to those shots in the arm, to getting access to the COVID-19 vaccines?
Well, that's a great question. Thanks for having me here today. It's an honor to join you and Dr. Vigilante. I'm getting my first shot tomorrow because that's when my time came up, and I'm doing it with zero hesitancy because of the great confidence that I have in Dr. Fauci and those that have worked so hard to make the vaccines available to us in this country. We have the privilege of serving the VA in the Western United States, Hawaii, Alaska, and the Pacific. And our job is to build the elasticity in the community to make sure that VA, when they're unable to deliver service directly, can deliver it through a network. In about a year and a half ago, we built out a network of pharmacies and urgent care. We did that in collaboration with Dr. Matthews, who was just on this town hall a little bit earlier. That network of pharmacies and urgent care centers allows 95% of veterans to have access to those sites within a 30-minute drive of their house. And about a week ago, we set up with the VA the backbone to make it possible to get COVID shots in that environment. It's been tested. We've been seeing veterans show up in that environment to get their vaccines. If you live a long ways away from a VA medical center, or if you live across town, it's going to take a long time, then that's a reasonable place to provide them. We did that last year with flu shots together with VA. It was very effective. And It's now wired up for COVID. And as the shots are arriving in to the pharmacies in the urgent care centers, people will be able to go there to get their access to the vaccines.
Well, that's great. I'm a big fan of convenience. I think that helps us get to where we want to be. So I love that. So if I'm a veteran, or my husband, who's now a veteran, is eligible for the vaccine based on the local vaccination plan, and they want to go out into the community like you described, how do you get that vaccine but still use the VA benefit to do that?
Yeah, you have to be enrolled in the VA, and you need to go to va.gov, and there you will find a locator tool that will allow you to look at the VA location itself, and also to see which pharmacies and urgent care centers might be located nearby. And there are instructions as to what you do. And you probably need to call and make sure that that location has the vaccine that you want. And then, like with the flu shot, you go there to get the vaccine, you get it, and we take care of all the billing and the record keeping and get that back into your file, and all is good. So you go to va.gov in order to find that information.
Well, that's great. And it ties back to the public-private partnership that Dr. Vigilante mentioned. And I think it's our feeling that when all of these different sectors work together, the nonprofits too, like American Red Cross and Blue Star Families and all of our colleagues, I think we get our best results that way. Thank you, gentlemen, both so much for joining us here today.
You're welcome.
Thank you. Kobe, let me welcome you back. We've been so fortunate to share this hour with a panel of experts from across the medical and military connected communities. Thank you all for your time, your passion, and your willingness to speak with our community today. I also would like to take a moment to thank our sponsors, both our Town Hall series, Homefront and Frontlines, and this Team Up Against COVID campaign in partnership with the Red Cross wouldn't be possible without you. Kobe, thank you for joining me today, and thank you to the American Red Cross for co-sponsoring this event with us again and for sticking with us through this campaign.
Thanks so much. I couldn't be more pleased to be working with Blue Star Families. I wrote down a couple of notes because I want everybody to remember. We've got 2 million veterans vaccinated, 1,000% increase in appointments at the VA. Secretary Austin reminded us science and facts are what matters. We had a great discussion from Dr. Matthews. Caregivers are eligible based upon the dependency of their veteran. We heard from Lieutenant General Place talking about the importance of listening, and not judging so that we can get everybody vaccinated. I just want to thank everybody on the webinar for joining us today and sharing your questions. We hope that the experts have gathered to help provide important information you can use to make the best decision for your family as it relates to the COVID-19 vaccine. Over the last year, more than 70,000 people across the country joined the Red Cross as volunteers and other organizations as well. If you'd like to help the nonprofits like the American Red Cross deliver its life-saving mission to military-connected communities and other nonprofits during this public health emergency, please consider visiting serve.gov. Again, thank you for joining us today and have a great afternoon.
Thank you, everyone, and we hope to hear how it worked for you. Thank you.